Really, the surgical treatments for benign prostatic enlargement can be divided into treatments that create a channel through the prostate and treatments that lead to some sort of cell death in the prostate, usually by heat, and subsequently the cells die and the prostate pulls back and then you have a clear channel to pass urine. The classic treatment is the standard transurethral resection of the prostate. What happens with that is we put a telescope through the eye of the penis, we cut away little chips of the prostate until you have a clear channel. You can think of it like an apple, and I was taking the apple core a little bit more out. Now during this procedure we use glycine, or this particular type of fluid. We can't use saline, the same thing we put in our drip, because it conducts electricity and we use electrical energy to cut the prostate. Some of this glycine can absorb into the system and very rarely can cause a serious problem called a TUR syndrome, where fluid is absorbed and it's like having water intoxication. Generally with a TURP we make little chips and cut the prostate, we get bleeding, and then we cauterize the vessels. So there is a risk of a transfusion and some risk of bleeding. Patients are usually in hospital for 2 to 3 days. They have a catheter put in afterwards, and after the procedure they have some burning and stinging which normally settles over a few weeks. It's really important to do this operation very carefully to prevent any tears in the capsule, the lining of the prostate. And these days we operate it through a big TV screen in theatre, so everything's very magnified. So the side effects of this operation has decreased. Patients do still suffer from side effects such as retrograde ejaculation. When they ejaculate, the semen may go back in the bladder. There's a 5 or 10% chance that it regrows with time, or you get an infection, or scarring of the neck of the bladder, or stricturing in the urethra. 1% of cases can develop some degree of incontinence, although this is very, very rare these days with improved techniques. So that's the standard transurethral resection of the prostate.